So if this is now a minimally invasive approach, they visualize the tools inside the body with X-rays, and then they have a fluoroscopy, massive monitor in front of them through which they can then see a 2D real-time image of the blood vessels of the patient. And if you consider then that you're lying on the table and you have a top view of your arteries or of your blood vessels, then you can see that there's a certain motion of an instrument that goes from point A to B. But this is all in 2D. So what they do these days is they also take a 3D preoperative scan. So say a CT scan that they took of the anatomy during diagnosis, the diagnosis stages. They then overlay that through a 2D, 3D calibration. And in real time, they can put the model of that 3D arteries on top of that 2D scan, and then sort of overlay it and sort of uh, ensure that what they see in 2D is now also applicable in 3 dimensions. And so you can actually rotate around and see, well, in addition to the guide wire reaching the proper location in 2D, is it actually reaching a branched fenestration that otherwise you would have seen from the top? And I think that is, of course, still extremely useful, but the drawback is just being exposed to ionizing radiation. And, strangely enough, we see surgeons, discussions we have with surgeons here at the hospitals, they are a bit nonchalant about it. They're like, yeah, well, maybe in 10 years I get eye cancer because I'm just being exposed to an excessive amount of radiation. And when we are observing in the hospitals, we are of course wearing these lead aprons, and when the surgeon has to take a quick scan to verify the tool position, everyone is scattering to the corners of the OR, and standing behind like a pillar or something, just so that the reflection of the X-rays don't hit you in some way. But the surgeon is there standing, don't care. It's just a normal occupational hazard. But yeah, those are the pros and cons, I would say. Is you have advanced visualization, you can really in real time guide such instruments, but of course then you have the exposure to the radiation, which of course should be reduced.